Okay, so let's talk implants. Let's say I have no idea what an implant is.
Mm-hmm.
How would you explain what a dental implant is to me?
So implants are for missing teeth. When you are missing a tooth, one teeth or two teeth, depending on, the ideal treatment nowadays is placing an implant. What implant is basically is the titanium screw, which is inserted into your bone where the tooth is missing, and the crown get attached to that screw on top of it.
Oh.
So that screw actually make a connection over the time with your bone, and it acts as a natural tooth. Like how the natural tooth has roots, that's how your implant gonna act as a root for that crown.
Oh, wow. So it's literally like you have like something holding like a potential new tooth, and then you actually put a cap over it or a crown over it.
Yes.
Wow.
Yes.
Okay. Is that painful?
So it also depends from patient to patient perspective of their pain threshold. Yes, it is a surgery, but it is not that painful as compared to taking a tooth out. I always say that way to my patients, so
right.
that when you have taken that tooth out, it would have been more painful. It's less painful than that. And when we are doing the procedure, I make sure that you're not in pain. During the procedure, you're not going to feel a thing. And afterwards, if you follow the instructions, it's going to be a little sore, of course. You're doing a surgery, it's going to be sore. Only for like 2-3 days, max for a week. Just follow the instructions, take your medications, you're going to be fine.
Okay, nice. So from start to finish, like, let's go over when I first need an implant to now I have my implants and I'm fully recovered. How long does that take?
So it requires at least 3 to 4 appointments, and depending on appointment length. First appointment, I usually take my time to educate my patient. I do CT scans, and then my patient and I together actually treatment plan digitally on the computer where the implant's supposed to go on the CT scan. And we take a digital scan of your face, of your bite, depending on case to case. And we merge the CT scan and the digital scan on the computer. And we kind of, how you have a 3D picture of your bone. So now we play around with that 3D picture. We put a tooth on that 3D picture on the computer, and we put an implant on that 3D picture. And that's our pre-planned digital surgery, which patient and doctor do it together. So patient is already aware of, okay, that's how my surgery gonna be. The second appointment, which I usually do 2 to 3 weeks after the first appointment, because then I prepare some surgical guides depending on the digital treatment surgery we did together. And that surgical guide gonna be actual replica of what we treatment plan on that day. When you come for the surgery, one implant usually can be done within 30 minutes.
Wow.
Yes.
That's fast.
It is super fast. So, and it's very less invasive. It's not that major surgery. Nowadays we have so many, cool digital instruments and stuff. So within 30 minutes, you have your implant being placed inside your mouth. And now that implant needs to heal. So that needs to heal for up to 4 to 6 months. So this is a waiting time. So you are without tooth for that time being. Once 4 to 6 months, you come back again. We take an impression of that implant and we make a crown or a cap of that impression, and 2 more appointments and you would be done. So in total, you would be looking at 6 to 7 months to start to finish.
Okay, wow. So how many implants can I have in my mouth? You said missing tooth, but what if I have like 3 or 4 missing or bad or cracked teeth that I just want to get an implant?
We can place as many implants as, as many teeth we have these days, It all depends on your bone. If you have healthy bone, enough bone, it's easy to place an implant. But nowadays, we have achieved options to get bone graft. We also try to place implants for patients who have no teeth, missing teeth for many, many years, and now they want to look for a permanent solution where they don't have to take their teeth in and out. So
Like a denture.
Like a denture.
Okay.
Yes. For those cases, we do implants supported denture, which never comes out, which is actually screwed to your implants.
Oh, interesting. So it's like one giant implant, I guess.
Yes, you can say that we place actually 4 implants
Okay.
at an angle so that we can dissipate our force of bite.
Oh.
And then we attach your denture. We kind of screw your denture to that implant.
So then I'm not sitting there removing a denture every night and putting it back in the morning.
Yes.
Oh, okay. So how would you help me decide if I needed an implant supported denture versus a standard denture?
So for every patient, I try to educate them to go for implant supported dentures or implant screwed dentures instead of a permanent denture, which in and out one, which patient in and out. There are 2-3 reasons why I would say that. If it's my mom or dad, I would definitely go with the implant one, and I consider all my patients as my family members.
Right.
So I want to do everything what is best for them. For in and out dentures, those which patients in and out, now those dentures are taking support from your tissue and from your bone. Your soft tissue is like a cushion. So every time you put your denture in and you bite, your tissue is the one which is taking all the force of your bite. And when that happens, your tissue is not solid. Like this is solid, that is not solid. So your tissue moves. When your tissue moves, underneath the bone, wherever there is extra force on the tissue and tissue is moving a lot, then bone gonna resorb over there. It happens throughout the time. Within 5 to 6 years, all of a sudden you feel like, oh, my denture is loose. It's coming out. It doesn't stay in the mouth, or it's causing a sore spot here. Now I got an ulcer here. I can't chew. My bite shifted. All these things happens over the time within 5 to 7 years because of all this extra load of your bite on the soft tissue, leading to bone resorption.
Wow.
When you go for implant one, that implant gonna maintain your bone, and all that load, all that bite force gonna go through the implant. And your denture is all connected to the implant. So there's no extra, bone resorption, no biting changes, there's no sore spots. All this is being taken care of.